Lavonne and welcome back to my YouTube channel. Today I'm going to be talking to you all about GBS, which is group beta strep bacteria. So what is this bacteria? Why does every woman in their pregnancy get tested for it? What happens if you're positive? What happens if you're negative? And then answers to some of your common questions. Before I get started, don't forget to subscribe down below, or there's that little boxy thingy, I believe, in this bottom corner. If not, it's in this little bottom corner that you can click to subscribe and not miss any of my videos. Let's get started. Hi. I think I just snorted. Between 35 and 37 weeks of your pregnancy, your doctor or your midwife is going to check for what's called GBS bacteria. So this GBS is a type of bacteria that can be found in the vagina. It's a part of our normal vaginal flora. Every woman in her vagina has a bunch of bacteria. And when you think of bacteria, you think of infection or like icky stuff. And GBS isn't icky. For a woman. All around your body, you have bacteria, and that bacteria helps to keep you healthy. We like our vagina bacteria because we want our vaginas being nice and healthy. About 1 in 4 women have this particular type of bacteria. Now, for you, if you're pregnant or even if you're not pregnant, the GBS bacteria in your vagina is not going to cause you any issues. In fact, it's a good bacteria to help keep you healthy down there. Between 35 and 37 weeks, your doctor is going to swab your vagina, meaning take like a little Q-tippy thing, and you'll spread your legs and they'll stick it just right inside the vagina and then drag it down to your rectum. It's very quick and it's very simple. They throw it in a little tubey, it goes to the lab, and then you find out whether you're GBS positive or GBS negative. If you're positive, all that means is that you are one of those 1 in 4 people that do carry that bacteria in their vagina. Again, no big deal. It is not an STD. It does not mean that you have an infection. It doesn't mean you need to take meds right now. But for labor is when it really matters. So once you get your results, then when you go into labor, once you get to the hospital or even in a home birth, they would give you an IV. You would get antibiotics every 4-ish hours, depending on the type of antibiotic used. Most of the time, they're gonna use a penicillin type antibiotic, and then that every 4 hours they'll give you until you deliver. So keep that in mind when you're trying to determine when to go to the hospital, because especially if it's your second, third, fourth baby, you're gonna wanna go a little bit earlier than if it was your first baby or if you didn't have GBS, because ideally we need to give you 2 rounds of antibiotics in order to be considered treated. If you're looking to be not connected to an IV and maybe just have what's called a saline lock, so you have access to the IV but it's not connected the whole time, the antibiotics typically go in about 30 minutes. So you can get the antibiotics and then ask to be disconnected so that you're not tethered to the machines quite so much. Little tip of the day. Now, why do we care about this bacteria? Because baby goes through the vagina and gets all that GBS bacteria all over them, and then it can make the baby very, very sick. And by sick, I mean within the first week-ish of life, they can end up with, the most common are bacteremia and meningitis. Meningitis is like an infection in the brain, and bacteremia is bacteria in your blood, which causes sepsis or widespread infection, both of which are very serious infections that we would really like to avoid. So if you have GBS, does that mean your baby's gonna get sick? No, it doesn't. Necessarily. They say that if you've been treated, your chance of your baby getting sick is 1 in 4,000, which is a really, really low number. But if for whatever reason you aren't treated, or it's not detected, or you don't do the test, or maybe you deliver really fast, your chance of infection is 1 in 200. So that being said, that is a really big difference, and ideally you do actually want to have time to get those antibiotics before you deliver. Another circumstance where they may treat you for GBS is if at any point in your pregnancy they found GBS bacteria in your urine, like you peed in a cup and they did some other testing and they found it, then they're going to treat you no matter at what point they found that bacteria in your urine. That's number 1. The other one is if you've had a baby that has been infected with GBS before, so you were positive for GBS, the baby ended up with the infection, then that would be another reason why across the board they would treat you while you're in labor with those antibiotics. If you are planning for a scheduled C-section, meaning it's planned, there's a medical reason for it, that you'll go in on a certain day and have your C-section, then your doctor may actually opt not to check you, because as long as your water bag is still intact, meaning your water's not broken yet and you're not actually in labor, then there really wouldn't be a reason to treat you prior to surgery, because that water bag is protecting the baby from the GBS bacteria, even if there was some in your vagina. People will ask me all the time if they can take pills during their pregnancy. Pills have actually not been shown to be super effective or to prevent GBS completely, especially because it's a part of your normal bacterial flora. So it usually doesn't kill off all the bacteria, and then they end up just growing themselves back by the time that you deliver. So pills in your pregnancy, probably not so effective, but the IV medication while you're in labor has been proven to be very effective at preventing GBS. If you, for whatever reason, don't make it to the hospital in time and you know you're GBS positive and you don't get treated before delivery, don't stress. Again, the numbers are still really low for the actual infection, but what would happen is they would watch your baby closely after delivery, and then they may do testing on the baby to make sure that the baby didn't get that GBS infection. So expect your doctor to test you between 35 and 37 weeks. When you get your results, they're gonna ask you for them when you get to the hospital likely, so just kind of have on your radar, yes, I'm positive, nope, I'm negative. That can play into when you go to the hospital. You may go just a tiny bit earlier, ideally 4 hours before delivery, not that you can really time that. If you're positive, great. If you're negative, great. Expect to be treated if you're positive. Give yourself adequate time to be there and get the IV with the antibiotics. Thanks everyone for being with me here today. Don't forget to subscribe, like, comment down below. If you have a comment or a question that you would like answered in a future video, I may make a whole video about it, or I may just answer your question in a Q&A video. Coming right your way. If you are anywhere in the world and looking for labor support, birth coaching, birth education, I got lots of stuff going on at bundlebirth.com. If you are in Los Angeles and looking for labor support or childbirth classes, I am here, so feel free to hit me up. And until next time, don't forget to flex and flow, and I will see you very soon. Bye. Videos. Let's get started. That was a big inhale. If you test positive, so they don't miss anything. There's also a little bundle birth, little guy. It's a little guy in the corner. Not a guy, like a little boxy thingy. Hey everyone, and welcome. I hope you can't see my rolls. Going to, I have an itch. I have an itch. A vagina bacteria that can be found. Oh my God, why is it so hard to get out? No. This is really bad. And by sick, and I mean, keep that vagina nice and clean. Clean. With me here today, I don't know how you know those girls. While you're in labor, no. Go on, and until next time, no.